Now let us start with the part 2, in which first we'll cover deafness. Deafness can be due to heredity, due to trauma, due to infection, or due to ototoxic drugs. Ototoxic drug means drugs of the ear, right? Ototoxic drugs. Again, heredity, trauma, infection, ototoxic drug. Management. Practitioners must manage the deaf child with a sense of touch. Facial expression, kindness and assurance expression should be reflected. Talk on a normal pace conversation. You cannot do sign language because you don't know the sign language. Yes, usually the dentist doesn't know, so you have to go through a special training if you want to do, or else just talk on a normal pace, neither fast neither slow, normal pace. Adjust the hearing aid. It is very important that adjust their hearing aid before starting the treatment. Next is the blindness. It can be due to the structural or developmental defects, can be due to trauma, can be due to systemic disorders, optic nerve defect, lens dislocation. Again, structural or developmental, trauma, systemic disorder, optic nerve defect, lens dislocation. Dental problems, gingival inflammation, plaque accumulation and traumatic injuries. Management, verbal picture of the operatory. Give a verbal picture of the operatory that okay, this is there, this is that and all like that. Must have patience, sense of touch, same with that kind of deafness, and make a physical contact which will give a reassuring feeling to the patient. Okay, next we'll start with Down syndrome. Children with Down syndrome are prone to certain dental problems, and preventive measures play a crucial role in maintaining their oral health. What are the common dental problems seen in them? First is the delayed tooth eruption. Children with Down syndrome experience the delayed tooth eruption. So, an early dental visit and a regular monitoring of the development can help and identify abnormalities and address them promptly. Second is the malocclusion. Malocclusion, such as malaligned or crowded teeth, is common in children with Down syndrome. Regular orthodontic evaluations and interventions, if necessary, can help the malocclusion and promote proper alignment of teeth. Next is the periodontal diseases. Children with Down syndrome may be susceptible to PDL diseases due to the factors like compromised immune function, plaque accumulation. So regular dental cleaning, proper oral hygiene practices and education for parents and caregivers are important. Next is the dental caries. Because dental caries, children with Down syndrome, they are at high risk of dental caries because of the enamel defects are present, altered saliva composition, dietary habits. Thus preventive measures include regular dental caries is due to the enamel defects, altered saliva composition, dietary habits and preventive measures, which includes regular dental checkup, brushing, flossing technique, fluoride application and a balanced diet with limiting sugary snacks and drinks. Next is the bruxism. Bruxism is the habit of teeth grinding or clenching. It is usually observed in children with Down syndrome. Dentist should refer a custom made mouthguards to protect teeth and alleviate the effects of bruxism. Next is the oral motor dysfunction. Oral motor dysfunction can affect the speech, swallowing and oral hygiene in children with Down syndrome. Speech therapy and occupational therapy can help improve the motor skills and facilitate better oral hygiene practices. So what are the common problems which we have seen? Delayed tooth eruption, malocclusion, periodontal diseases, dental caries, bruxism and motor functions dysfunction. That will include the speech, swallowing difficulty, etc. So it is very important to have a preventive measures for such patients. Other systemically involved conditions with Down syndrome are cardiovascular issues. They have congenital heart defects. So regular cardiac evaluation and appropriate medical management is important. Dental difficulties, limited cooperation during dental visits due to cardiac issues, and need for coordination between dental and cardiac care providers. Hypotonia, that is weak muscles, modified dental positioning and techniques, difficulty in maintaining open mouth position for a long time treatment, need for specialized dental techniques and adaptations. increased risk of infection, so enhance infection control protocols, high susceptibility to infection, strict infection control protocols, medication side effects because they may be under many medications, so it might give a side effect, so close collaboration with healthcare professionals, dental difficulty, adverse effects on dental health and treatment, consideration of medication interaction and side effects and treatment plans. Other systemic conditions, respiratory infection, GIT infections, urinary tract infections. So basically a very thorough infection control protocol should be taken care of. So now let us come upon the general management of developmentally compromised patients. Establish a dental home. Early establishment of a dental home is crucial, ideally by the child's first birthday or upon diagnosis of systemic condition. The dental home serves as a central point to dental care and coordination for the individual's oral health care needs. Number 1, establish dental home. Then what are the responsibilities of dental home? It will give a comprehensive oral health assessment and risk assessment, prevention and management of dental issues including dental caries and periodontal disease, collaboration with health team members to address systemic conditions, development of an individualized treatment plan. Dental visits, regular dental visits at recommended intervals which will tailor the individual's need and risk profile, early establishment of a positive dental experience using behavioral management technique and sensory friendly approaches. Now, management of dental issues, preventive, individualized preventive strategies, oral hygiene instructions, fluoride application, dietary counseling, early identification and intervention for dental caries, malocclusion, periodontal disease and other oral health issues, orthodontic evaluations, collaboration with specialists. Now, next is the infection control. Establish a dental home, responsibilities of a dental home, dental visits, management of dental issues, infection control measures, strict adherence to infection control protocols including proper sterilization, personal protective equipments and maintenance of a clean dental environment, consideration of additional precautions for individuals with compromised immune system or a history of respiratory or urinary tract infections. Communications and collaboration. Effective communication with the individual caregivers, healthcare team members to ensure coordinated care and understanding of treatment plans. Sedation and anesthesia. When necessary, consider use of sedation and anesthesia in consultation with the individual's healthcare team and experienced professionals. Regular follow-up and monitoring. Schedule recalls based on the individual's need, condition with periodic regulation of treatment plans. Ongoing monitoring of oral health status, systemic health and the impact of systemic difficulties on dental care. Okay. Once again, establish a dental home responsibilities, dental visit, management of dental issues, infection control, communication, collaboration, sedation, regular follow-up and behavioral modifying techniques which we have discussed in part 1. Those were the, I'll say it again, like the visual support, desensitization and gradual exposure, positive reinforcement, communication strategy, environmental modifications, tell show do, parental involvement, patience and flexibility and picture exchange communication system, the sensory techniques and the animal assisted therapy. These are the general management which can be done for the patients, for patient of developmentally compromised. Now some references are there from where I have taken and have to remember. I pronounce this as Hunya, Huynh, Hunya et al. 2018 has given done a study on the picture exchange communication system. Huynh et al. In the year 2018 on PECS. Steinhardt T. et al. 2018 on animal assisted therapy. Winkle et al. 2020 animal assisted therapy. Glover et al. 2017 Down syndrome. Effective management requires early intervention. This study concluded that effective management of Down syndrome involves the early intervention. Kaur M et al. 2018 Down syndrome, regular monitoring and multidisciplinary approaches needed. Desai S et al. 2020 Down syndrome requires collaborating and addressing specific challenge. AAPD Guidelines and Management on Autistic Spectrum Disorder 2020 and AAPD Policy on Dental Home Reference Manual 2020 and 2021. These are the references. I hope this topic is clear, and if any confusion, doubt or anything, you can anytime post in the comment section. I'll be happy to help you. Thank you.